All right, so today we're going to teach you about the L5 blocking. What happens is in the sacrum and the L5 there can become a misalignment, also known as a subluxation. And that's where the vertebra shifts backwards. That leads to a lot of pain. It's a very common thing. It usually happens from a lot of sitting. Sometimes some sports injuries, but what ends up happening is it flattens out the back, it causes pressure on the nerve going down into the legs eventually, and also leads to degenerative changes in the lumbar spine over the course of about 10 years. And that's because the disc itself needs a blood supply. Without that blood supply, it starts to decay, it starts to get thin. That's why we thin as we age, or we shrink as we age. And the research shows that the more you shrink as you age, the worse your health outcomes and the closer you are to death. That's because when you shrink, there's less hole for those nerves, and the less space in the hole. And when those nerves get impinged, you can't work right. Nothing works right without the nervous system working right. So this is a very relieving thing to do, very helpful. I think you'll enjoy it. These are called Sacral Blocks. You can get these on Amazon. Just type in Sacral Blocks. There's lots of options. And the place we're going to put them is called the ASIS, which is this bump right here on the front of the pelvis. And that's going to lift the pelvis up to let the L5 sink back down. I'm going to put one here and on the other side, both going like this, kind of like you're putting them in your pockets. And as you do that, it raises the hips up, like I said, and this L5 gets to sink back down. When your lower back is very inflamed, you can put a pack of ice here for about 10 minutes or so. But I wouldn't do this more than that, because too much change at once makes you sore. This is an X-ray prescription exercise, and the reason is because if you have a condition called spondylolisthesis, which some people do, that's an injury in the lower back causing the vertebra to shift forward, that would be contraindicated, and this would be a different thing I would have the person do. So if you don't have a spondylolisthesis, this can be done. The only way to find that out is getting x-rays, and I do recommend if you ever go to a chiropractor, do not go to one that does not take x-rays.